Hi there, Dr. Tansavatdi here. Today, I'd like to answer some questions regarding septoplasty surgery. Now, patients, when they come in for a consultation regarding rhinoplasty, they often find that their septum is deviated and they didn't even know that it was. So what can we do to correct a deviated septum? Well, the surgery is called a septoplasty, and that requires sometimes a closed approach, which means we make an incision inside the nose and we expose the crooked septum and we take out the part that's crooked and then we close everything up. Now that is usually probably about 50 to 60% of my cases is closed, the approach is closed and it doesn't affect the shape of the nose. However, sometimes the septum is deviated and it also contributes to a crooked nose. As I explained in a previous video, I explained that the septum is like a wall and it separates the two sides of your nose. Now the wall can lean over to one side. If the whole complex leans, the bridge of your nose also leans with it, and so your nose will look crooked. So when that happens, I like to do an open approach, and that's because if you think about it, if we do everything on the closed side, we're working on just the middle of the septum, but the very top is the support of your nose, and so we have to really open the nose, restructure the septum, and keep the support of your nose intact. If we do too much, then the septum will collapse and now you'll have even more problems. The bridge of your nose will then become a saddle nose deformity. And that's something that you can see in boxers. If you've seen some boxers, they got a very flat part of their nose here and it's depressed. And that's because they've gotten hit so many times in the nose that now the septum is crumpled and that means the bridge has collapsed. So an open approach can correct all of that. It can make your nose straight again, and it can also fix the area that's where the septum has crumpled and the bridge of the nose has collapsed. So all those will affect the shape of the nose. As I want to recap again, I'm going to go back here and say that for a deviated septum, there's two ways to approach that, and that is through either a closed approach or a closed septoplasty, or a second approach is through an open approach. And that's probably a majority of my cases when I do a cosmetic case and there is a deviated septum, I just go ahead and open the nose. All right, for more information, go ahead to my YouTube channel and you can find more videos on this topic. Thank you for listening.